Hi guys, I'm Ashley. So I'm going to do my case assessment on a client from my job. And I chose to do a client from my job versus my internship, just because I think that it's unique in the sense that it's combining the challenges of working with significant behaviors, high level of care, as well as a medical component that goes into that. And I think there's also some ethical concerns that could be at play, and I want to hear some of your maybe thoughts on it. Um, I guess around some of that stuff. Um, let's see. So the client that I'm going to be talking about, she is a white female. She's about the age 23. Um, who's of low socioeconomic status and has significant mental health diagnosis. This is also combined with a developmental and intellectual disability. So I think the presenting problem here is that I, I run a group home for adults with developmental disabilities. So we have three girls living in the house, one of which had just moved in. And recently, I believe within the last 2 months, just got a very significant surgery. She was not intending on staying with us full time, and she was on a temporary placement. And um, so I guess with that, she has significant behaviors, um, and then now she's coming in with some of these extra needs, medical needs because of this surgery. So basically, the surgery that she got was it's called an ileostomy, and what that is it's where the I believe large intestine can't digest food properly, and so what they do is they completely bypass the large intestine, and they take the end of the small intestine and place that they kind of loop it outside of the body in what's called a stoma, and um, and then that's where the waste and feces and stuff can come out into an external bag that's attached to the skin. And so there's a wafer, is what they call it, so it's basically a sticky thing to put on the skin, and then there's an attachable bag that goes all the way around it. Um, so uh, obviously, all of our staff was very trained on how to work with behaviors and all of those things. And when the medical component came in, everyone just kind of freaked out. They didn't know what to do, and I think um, a lot of people just didn't really have experience with this. Um, and so to kind of backtrack a little bit, I think this is where the ethical issue can come in, is we have had an overnight staff who's here 2 nights a week, and has not been okay. So the bag has to be emptied or has to be at least checked every 2 hours. So overnight, that would be 8, 10, 12, yeah, until the morning. Um, and so this specific staff had not been checking the bag like they should. The bag ended up getting too full, breaking open. It was all over the skin, and this client ended up having a rash as a result of that, as a result of the feces being on the skin overnight, laying in that. And I mean, there's other instances where it doesn't break open, but the morning staff has to come and it's completely full and everything like that. So here's another piece to that is there's only certain staff who have been trained to actually change the wafer. There's only been a couple staff who's actually been fully trained on how to actually empty it through kind of our supervisor. And I think there's a lot of people coming in and saying, hey, this person said this, and like going down the line rather than actually having a big meeting about how this should go. So I think that really freaked a lot of people out. So yeah, and then for the longest time, the doctors had told us that we aren't supposed to replace the wafer. And so if the wafer comes off, the sticky part comes off, there's nothing really that we can do about it. So in that place, we're putting her at risk of getting some type of infection, putting other people at risk of getting some type of infection. It's just kind of this thing. And then, of course, if there's a behavioral instance that happens and, this bag is broken open, what kind of ethical issues does that place on, I don't know, I guess just having feces around the house and for the other girls. So, okay. So basically the role of our agency is to provide unique services to unique clients who present a challenge for traditional programming options. So my role at the agency is I'm a house manager, a direct care provider, and I also live there part-time. So as I had mentioned before, so she had been temporarily placed with us. However, I think her team has seen the impact of consistency and the predictability that we have at the house. So she is, I think we're planning on having her stay for a longer period of time. So with that, she's been placed in and out of placements. She's been kicked out of placements, and of course that's a lot to handle, especially for her coming into a new environment that's completely different than residential facilities and like foster care, like foster homes and things like that. So let's see. So her strengths, I think this client's very, very resilient in the fact that she's endured and had to overcome a lot of trauma and medical procedures. She is able to advocate for herself when she needs extra help. And so granted, she's very nonverbal, but she also is able to speak a couple words to get her needs met, and I think that's awesome. So there's some things that I think she's very concrete in her thinking, which kind of can create a disconnect and make more of a guessing game, I think, between staff and her. Her biological factors, we don't know much about her history of medical stuff. I know that she grinds her teeth, so there's some dental stuff going on, overweight. She has the ileostomy now, and I've also observed some poor postures, especially when she sleeps. So instead of laying flat on the bed, and I think it's kind of like a self-stimulating thing, she will tuck her head in against the wall and sleep like this basically all night long. So yeah, mom has very significant mental health diagnosis of her own, which she's not capable for carrying full-time and having full-time custody of her or anything like that. And of course, she's 23 years old too. Dad's not in the picture, and so mom comes to meet with her once a week to maintain some of that relationship piece for her, which I think is really sweet. So psychological factors. So she has autism and moderate intellectual disabilities. So like I said, she is very concrete in her thinking, difficult time regulating emotions, and has significant behaviors as a result. She's been known to be, physically and verbally aggressive. So some of her behaviors can look like fecal smearing, urination, scratching, spitting, biting, all of those things. I think that this client is very, she's very relationship oriented and wants to please others. She has shown that she is proud of herself by, showing excitement for things that she's able to do independently. She has a hard time communicating some of her needs due to nonverbal being nonverbal. But because of that, she's still able to show self-advocacy, which I think can be very empowering for her. Um, so some of the spiritual factors, she's, like I said, concrete thinker. Everything's right, right, wrong, good, bad. Um, I think there has been some significant trauma, and this could be involved or surrounding around maybe wetting the bed or things like that, because immediately as soon as she wets the bed, she starts crying. She will hide her diaper or her pull-up under the bed so that staff doesn't see that she had wet the bed. So little things like that. So I think there's that guilt and shame piece surrounding bedwetting, and so yeah, we think that there was some type of abuse at some point surrounding that. Um, she has a lot of people who make up her team and who are involved in her decision making. So a couple of them are governmental agencies that impact her, which is the state of Colorado's healthcare policy and finance, and Department of Public Health and Environment. She has a caseworker, a PASA, which is part of some of those social institutions that are involved with her. Um, so in her environment, her physical environment, she lives in a group home, obviously with 3 other girls, with people coming in and out all the time. It's a very quiet neighborhood, and her basic needs are met, and there's a very consistent and strategic structure to the way that her day is set up. Uh, when it comes to groups, organizations, and communities, she has many opportunities to be involved in many various organizations in the community. So she has employment, she does community connection type work, she is involved in many community outings as groups. So I would say also, when it comes to community, our agency is a community. We have many different, um, I guess, areas that we work out of up north, here in Denver, so kind of scattered around the whole area. So she sees peers and staff pretty consistently, and has opportunities to work and engage with each member of our community, and outside of kind of this agency community. Um, so I think overall, so she's new to the agency, she's new to the home, and for her acclimating to the culture of our agency, her new life, the significant medical surgery, um, so I guess within this system, she's getting used to different staff from different backgrounds and comfortability with this medical and supportive needs. Um, this problem is, I would say, on an individual and organizational level. Um, there are plans to educate some of the staff that are uncomfortable with emptying her bag. And I guess if they're not comfortable with that, then we can't have them doing overnights, because I feel like that's kind of an ethical dilemma for me. Uh, I guess some of the pieces too is, and I want to get feedback from you guys too, but should I set up a meeting to where we can all sit together and figure out what is it about changing this bag that makes people feel uncomfortable, or I guess maybe is it a factor of familiarizing people or normalizing the situation? I don't know. I just want to get some of your guys' feedback on some of that. I'm trying to think if there's anything else. Yeah, and just seeing if there's any other ethical pieces that you guys see that maybe I'm missing. And then also, this intervention's coming from a micro and meso level of social work, due to the needs, of talking to staff, of working with the client, and creating a sense of community around the problem at hand in the house. So yeah, I kind of went over some discussion questions a little bit ago, but what do you think the biggest challenge is for people when it comes to caring for someone who has significant behavioral needs, and then also adding the layer of the medical need to that. Um, that kind of goes into like, is it, I don't know. I would just like to hear your opinions and thoughts. But yeah, have a good night.